Arthritis is a common condition that affects millions of people worldwide. It causes pain, swelling, and stiffness in the joints. Managing arthritis often involves medications and lifestyle changes, including adjustments to your diet. Research suggests that there are more than 100 types of arthritis present. Osteoarthritis is the most common form among them. Surprisingly, some everyday foods may make arthritis symptoms worse. These foods, ranging from popular snacks to staple ingredients, may contribute to inflammation and worsen arthritis symptoms. Whether it's the sugars in your favorite soda or the fats in a juicy steak, knowing what to watch out for may make a significant difference. That's why in today's video, we will talk about 10 harmful foods for arthritis that you might be eating unknowingly. Stick to the end of the video and we will tell you about a few habits that also contribute to arthritis. 1. Red meat. Red meat, such as beef, pork, and lamb, may contribute to developing or worsening arthritis due to several factors present within it. One significant element is the high level of saturated fats found in red meat. Saturated fats may lead to inflammation in the body. When consumed in large quantities, these fats may trigger the release of adipokines, which are proteins involved in inflammation. This process may exacerbate the symptoms of arthritis, leading to increased joint pain and stiffness. Additionally, red meat may contain a type of iron called heme iron, which, in high amounts, may also promote oxidative stress. Oxidative stress occurs when there's an imbalance between free radicals and antioxidants in your body. This imbalance may damage cells and tissues, including those in the joints, further contributing to the inflammation and degradation of cartilage, which are hallmarks of arthritis. Therefore, the consumption of red meat may contribute to the progression and severity of arthritis through the combined effects of saturated fats, ages, and heme iron-induced oxidative stress. According to a study with 217 people, red meat commonly increases rheumatoid arthritis symptoms. 2. Processed meats. Processed meats, such as sausages, hot dogs, and deli meats, contribute to developing arthritis through several detrimental elements. One primary concern is the high sodium content in these foods. Sodium is used extensively in processed meats for preservation and flavor enhancement. Consuming large amounts of sodium may lead to water retention, which increases blood pressure and puts additional stress on the joints. This may result in swelling and discomfort, particularly in individuals with arthritis, exacerbating their symptoms. Another significant factor in processed meats is the presence of preservatives and additives like nitrates and nitrites. These chemicals are used to prolong shelf life and maintain the color of the meats. However, nitrates and nitrites may induce inflammation in the body by promoting the production of inflammatory molecules. For those with arthritis, this means that eating processed meats may lead to a heightened inflammatory response, worsening joint pain and stiffness. Processed meats are also high in advanced glycation end products, ages, similar to red meat, but often in even higher concentrations due to the cooking and processing methods used. Ages may increase oxidative stress and inflammation, which are major contributors to the degradation of joint tissues. For individuals with arthritis, consuming foods high in ages may lead to more severe and frequent flare-ups of their condition, making it harder to manage symptoms effectively. According to a study, the intake of highly processed foods may increase your risk of inflammation and obesity. Both of these factors are positively associated with rheumatoid arthritis. 3. Sugary beverages. One key element found in sugary drinks that may contribute to arthritis is the high fructose content found in these drinks. Fructose may lead to increased production of uric acid in the body. Elevated levels of uric acid may cause crystals to form in the joints, leading to a type of arthritis known as gout. Even for those without gout, high uric acid levels may contribute to inflammation and joint damage, worsening arthritis symptoms. Another harmful component of sugary beverages is their ability to cause rapid spikes in blood sugar levels. When you consume drinks high in sugar, your body experiences a quick increase in glucose, which triggers an inflammatory response. This inflammation may affect the entire body, including the joints. For individuals with arthritis, this means that consuming sugary beverages may lead to increased joint pain, swelling, and overall discomfort. According to a study, those who drank fructose-sweetened beverages 5 times per week or more had a 3 times higher chance of having arthritis than those who consumed few to no fructose-sweetened drinks. 4. Refined carbohydrates. Refined carbohydrates, found in foods like white bread, pastries, and many processed snacks, have a high glycemic index. It means they cause rapid spikes in blood sugar levels. These spikes may lead to an increase in the body's production of insulin and inflammatory cytokines. Inflammatory cytokines are substances that promote inflammation, and for individuals with arthritis, this may mean more frequent and severe flare-ups of joint pain and swelling. Another problematic element of refined carbohydrates is their lack of nutritional value, particularly fiber. Unlike whole grains, refined carbohydrates have had their fiber content stripped away during processing. Fiber is crucial for maintaining a healthy gut microbiome, which plays a role in regulating inflammation. A diet low in fiber may disrupt the balance of gut bacteria, leading to increased systemic inflammation. This inflammation may extend to the joints, worsening arthritis symptoms and making them harder to manage. Additionally, refined carbohydrates contribute to weight gain and obesity, which are significant risk factors for arthritis. These foods are calorie-dense but do not provide a sense of satiety, leading to overeating. Excess body weight puts additional stress on weight-bearing joints such as the knees and hips. This increased pressure accelerates the breakdown of cartilage, exacerbating conditions like osteoarthritis. 5. Fried foods. Fried foods, such as French fries, fried chicken, and donuts, may contain trans fats. Trans fats are created during the hydrogenation of oils and are commonly used in frying. These fats may lead to increased inflammation in the body by promoting the release of inflammatory cytokines. For individuals with arthritis, this means that consuming trans fats may lead to more severe joint inflammation and pain. Additionally, the presence of advanced glycation end products, AGEs in fried foods, may also impact arthritis symptoms. AGEs form when proteins or fats combine with sugars during high-temperature cooking processes like frying. These compounds may trigger oxidative stress and inflammation, which are key contributors to the degradation of joint tissues. In individuals with arthritis, AGEs may accelerate the breakdown of cartilage and worsen joint function, leading to increased pain and reduced mobility. In fact, age accumulation in bones and joints may escalate the development and progression of osteoarthritis. Apart from that, fried foods are also often cooked in oils high in omega-6 fatty acids. While omega-6 fatty acids are essential for health, an excess may disrupt the balance between omega-6 and omega-3 fatty acids in the body. This imbalance may promote inflammation, as omega-6 fatty acids are precursors to pro-inflammatory molecules. For those with arthritis, consuming fried foods regularly may lead to a chronic inflammatory state, exacerbating symptoms and making them harder to manage. 6. Dairy products. Dairy products, such as milk, cheese, and yogurt, may contribute to developing or worsening arthritis due to casein. It is a type of protein found in high quantities in dairy products. For some individuals, casein may trigger an inflammatory response. This inflammation may exacerbate arthritis symptoms, leading to increased joint pain and stiffness. Those with a sensitivity or intolerance to casein may find that consuming dairy products leads to more frequent and severe arthritis flare-ups. Another important factor is the saturated fat content in many dairy products, particularly those that are high-fat, such as whole milk butter and many cheeses. Saturated fats may contribute to overall body inflammation by stimulating the production of inflammatory cytokines. These cytokines may worsen arthritis symptoms by increasing inflammation in the joints. Additionally, a diet high in saturated fats may lead to weight gain, further stressing weight-bearing joints like the knees and hips, and exacerbating arthritis symptoms. But you must remember that different types of milk play a unique role in arthritis. Research suggests that a higher consumption of full-fat dairy and Dutch cheese, except milk, was linked with a lower presence of knee osteoarthritis. 7. Alcohol. Alcohol consumption may elevate the levels of inflammatory markers such as C-reactive protein, CRP, and cytokines in the bloodstream. These markers indicate increased inflammation throughout the body, including the joints. For individuals with arthritis, this heightened inflammatory response may worsen symptoms like pain, swelling, and stiffness. Alcohol-induced chronic inflammation may also hasten the progression of arthritis, worsening joint damage over time. Alcohol also impacts the liver's ability to manage and detoxify inflammatory substances. The liver plays a crucial role in filtering out toxins and maintaining overall bodily health. Excessive alcohol intake may impair liver function, reducing its efficiency in processing and eliminating inflammatory compounds. This impairment may lead to a buildup of these substances in the body, further exacerbating inflammation and arthritis symptoms. Additionally, impaired liver function may affect the body's overall immune response, potentially worsening autoimmune forms of arthritis, such as rheumatoid arthritis. According to a study of people with axial spondyloarthritis, alcohol intake may increase spinal structural damage. 8. High-sodium foods. High-sodium foods may lead to water retention in the body. This retention increases the volume of fluid around the joints, leading to swelling and additional pressure on the joint tissues. For individuals with arthritis, this added pressure may exacerbate pain and stiffness, making it more difficult to move and perform daily activities. Moreover, consuming high-sodium foods may cause an increase in blood pressure, which affects the overall circulation and health of the joints. High blood pressure may reduce the delivery of essential nutrients and oxygen to the joint tissues, impairing their ability to repair and maintain themselves. This may accelerate the degeneration of cartilage and other joint structures, leading to more severe arthritis symptoms over time. Along with that, high-sodium foods are often associated with low-nutrient, high-calorie diets that contribute to obesity. Fat tissue in obese individuals produces inflammatory cytokines, which may further aggravate joint inflammation and pain. The combination of water retention, elevated blood pressure, and obesity-related inflammation makes high-sodium foods particularly harmful for those with arthritis. Research suggests that high salt intake is linked with a higher risk of developing rheumatoid arthritis, especially in those who smoke. 9. Gluten-containing foods. Gluten-containing foods are bread, pasta, and cereals made from wheat, barley, and rye. One significant factor is the potential for gluten to trigger an autoimmune response in individuals with celiac disease or gluten sensitivity. In these individuals, consuming gluten may cause the immune system to attack the lining of the small intestine, leading to inflammation and damage. This autoimmune response may extend to the joints, causing inflammation and exacerbating arthritis symptoms, such as pain, swelling, and stiffness. In addition to that, gluten may play a role in promoting inflammation even in those without celiac disease. Some individuals may experience a condition known as non-celiac gluten sensitivity, where gluten ingestion leads to systemic inflammation. This inflammation may affect the joints, worsening the symptoms of arthritis. Chronic inflammation from gluten sensitivity may accelerate the degradation of joint tissues, making arthritis harder to manage and more painful over time. People who suffer from celiac disease also have a higher chance of developing rheumatoid arthritis than those without celiac disease. 10. Corn oil. Corn oil may contribute to the development and worsening of arthritis through several mechanisms. One major issue is its high content of omega-6 fatty acids. While omega-6 fatty acids are essential for health, they must be balanced with omega-3 fatty acids to maintain proper inflammation control in the body. Corn oil has a disproportionately high level of omega-6 fatty acids compared to omega-3s. When consumed in excess, omega-6 fatty acids may promote the production of pro-inflammatory molecules. This imbalance may lead to increased inflammation throughout the body, including the joints, exacerbating arthritis symptoms like pain, swelling, and stiffness. Another critical factor is that corn oil, often used in processed and fried foods, may contribute to weight gain and obesity. Obesity is a significant risk factor for arthritis, particularly osteoarthritis, because excess body weight places additional stress on weight-bearing joints such as the knees and hips. This added pressure accelerates the wear and tear of cartilage, leading to increased joint pain and reduced mobility. Moreover, corn oil is also highly processed, often undergoing refining, bleaching, and deodorizing. These processes may strip the oil of beneficial nutrients and introduce harmful compounds. For instance, the high-temperature processing of corn oil may generate trans fats, which are known to increase inflammation in the body. Trans fats may disrupt normal cellular functions and promote the release of inflammatory cytokines, which may worsen arthritis symptoms. The combination of high omega-6 fatty acids, their contribution to obesity, and the presence of trans fats make corn oil particularly harmful for individuals with arthritis. Instead of corn oil, people should consume omega-3 enriched foods such as oily fish, oily seeds, and green vegetables to keep their arthritis under control. Let's discuss other daily habits that contribute to developing arthritis. Now that you know how diet plays a role in worsening arthritis, there are several other habits that may worsen arthritis symptoms and accelerate the progression of the disease. 1. Sedentary lifestyle. Lack of physical activity may lead to stiffness and weakened muscles around the joints, making arthritis symptoms worse. Regular exercise helps maintain joint flexibility and strength, reducing pain and improving mobility. 2. Poor posture. Bad posture may put additional strain on certain joints, exacerbating arthritis pain, particularly in the spine, hips, and knees. Maintaining proper posture helps distribute weight evenly and reduces unnecessary stress on the joints. 3. Smoking. Smoking is linked to increased inflammation in the body, which may worsen arthritis symptoms. It also impairs blood circulation, which is vital for joint health and healing. 4. Overuse of joints. Repetitive stress on joints may cause further damage to cartilage and exacerbate arthritis. It's important to balance activity with rest and use joint protection techniques to prevent overuse. 5. Inadequate sleep. Poor sleep quality or lack of sleep may increase pain sensitivity and inflammation in the body, making arthritis symptoms worse. Ensuring adequate, restful sleep is crucial for managing arthritis. 6. Skipping medication. Not adhering to prescribed medication regimens may lead to uncontrolled inflammation and the worsening of arthritis symptoms. It's important to follow medical advice and take medications as directed. 7. Ignoring joint pain. Pushing through joint pain without addressing the underlying cause may lead to further joint damage. It's essential to listen to your body and seek medical advice if pain persists or worsens. Understanding the impact of these foods on arthritis may help you make informed dietary choices. Managing your diet effectively may significantly alleviate arthritis symptoms and improve your overall quality of life. Always consult with a healthcare provider or a nutritionist to tailor dietary plans to your specific needs and conditions. Now that we have discussed the many foods to avoid in arthritis, let's dive into other topics of interest. Interested in knowing more about tips and tricks to shed pounds easily? Let's keep the conversation going with a couple more weight loss related videos. Shall we? Watch 16 healthy foods that help you lose the most weight. You may also try our video on 13 weight loss tips to get rid of your bloated belly fat. Go ahead and click one. Or, better yet, watch both and learn more about weight loss and nutrition. Do you eat any of the earlier mentioned foods? Let us know in the comments below.